guys, welcome back to my Mom Uses Life channel where I share with you guys my journey as a first-time mom, dentist, and business owner. My last video, I shared with you guys what to do when your baby falls and injures a tooth. In today's video, it's going to be part 2 of this series where we've moved on from baby teeth to permanent teeth. So make sure you pay attention. This is really important stuff because you never know if it's going to happen to your child. So without further ado, let's get started. So when somebody injures a tooth on a permanent one, we typically will see 3 different categories of trauma. One is probably just a chip or you broke the tooth. If it's a really small injury, we may be able to just go in there, put a small filling in, which we call a composite, and we'll basically rebuild the tooth, make it look like a normal tooth again. If you broke it a little bit bigger where, you know, there may be some sensitivity, we may have to put some medication down. If we can, we will put a white filling in. Otherwise, we may have to put a crown or a cap that basically goes over the entire tooth so that you don't end up breaking the tooth again. In these situations where it's broken a little bit more severely, we may end up also needing to do a root canal on it. And sometimes with the root canal, we may not be able to tell if you need it right away. Sometimes the tooth will seem fine, and then years down the road, you know, the tooth may end up dying on us, and we may have to do further treatment. So I always let my parents know that, you know, everything seems to be stable right now. However, you know, we want to keep an eye on it and look out for these symptoms so that, you know, we can treat it if something else is needed down the road. And you'll know because a lot of times, you know, your child will end up getting like an abscess or a swelling in the lip. They'll tell you that they're having a lot of pain that will linger on for a while. So these are all signs that, you know, something is wrong and we may need to go back in and do a further treatment on it. Okay, so that's the first category. The second type is you may displace the tooth or you move the tooth somewhere where it's not supposed to be. In these situations, you know, sometimes we may let it drift back into place, kind of like the baby teeth, or we may have to, you know, go in there and bring in an orthodontist and have them kind of reposition the tooth depending on how it got injured. So that's number 2. Number 3, the one that people kind of freak out the most about, is like when you completely avulse the tooth or you completely knocked it out as if we pulled the tooth out. So what do you do in these situations? First thing, of course, you know, call your dentist. They'll try to get you in right away because this is the time-sensitive part that I was talking to you about. The other thing that's really important is knowing how to handle the tooth during transit as you're going to the dental office. Okay, so the number one most important thing to do is do not let the tooth dry out. Okay, so the worst thing you can do is just like have it sitting in a plastic bag with no, you know, type of moisture at all, or just sitting out in a paper cup. So we don't want to let it dry out. The best thing that we can do, the most ideal situation, is you put it into a solution that is actually perfect to keep the tooth hydrated. And you can buy these things online. One brand is called Save the Tooth, and I will actually include a link to it in my comment box so that you guys can go check it out. It's not a bad idea if you guys have kids to keep this on hand. Something to keep in mind though, it does have an expiration date, so, you know, kind of keep track of that. You may end up having to throw it away and buy another one, but that's okay. I'd rather you guys not need it and have to throw it away than, you know, need the actual solution. But that's really nice to have on hand because that's the ideal thing to put the tooth in. Okay, if you don't have that, the next best thing is to put it in some milk. Okay, seems weird, but the concentration of the milk works really well to keep that tooth safe until we can get it treated. The other thing, step down from the milk, is just keeping it in a damp paper towel just to keep it hydrated, okay? Try not to, if you notice that the tooth fell out and it fell into a pile of dirt, it seems gross, but try not to, you know, rub it all off and try to clean it really well because you may actually damage the surface of that tooth, which is really important in the success of us putting the tooth back in and have it actually, you know, get reimplanted. Okay, so that's what you do. You bring it in. When we see the patient, we will try to put the tooth back in. We'll probably take a couple x-rays to make sure it's in the right spot, that nothing else got injured or fractured. And then after it is implanted, ideally, we will go ahead and kind of bond that tooth to the teeth next door just to kind of stabilize it, almost like a cast for the tooth, so that we don't injure it while it's healing. Then we talk about supportive care, of course. You know, we might recommend Tylenol or like ibuprofen to kind of help with any pain, icing the area for swelling, soft foods, try not to bite on that tooth. All these things we'll talk about so that you guys know what to do after you go home. And we typically will just wait a few weeks, have the patient come back in. We'll check it out again, see how the patient's doing. Hopefully at this point, you know, you guys won't be in any pain anymore. Now it's a matter of, you know, if everything looks stable, we can probably go ahead and remove that splint or the bonding that we did to keep that tooth there. And then, of course, like the other categories, I will probably tell the patient and the parents that, hey, you know, the tooth seems to be okay right now, but we'll probably most likely end up needing to do a root canal on it, either, you know, at that time during the post-op or later down the road. But I definitely always get my endodontist involved at that point just to see if a root canal, you know, is needed right then and there. So those are a few things to keep in mind. So just remember, biggest thing is don't panic. If the tooth completely comes out, keep it wet. And again, you know, I'll be posting a link to that in my comments so that if you guys want to buy that solution, you guys can. I hope you guys found this video useful. Hopefully it never happens to you, but if you do, now you know what to do and everything will be okay, okay? So hope you enjoyed this video. If you like this video, please make sure you hit the like button and subscribe. Tell me any other topics that you guys want to hear about, and I'll be sure to get you guys that information next time. See ya.